Lineage plasticity is a process which cancer cells can change their identity and become someone they are not before. Think about the whole concept of any anti-cancer treatment. Is cancer cells have some identity, make them different from normal cells, right? So we can target them by our anti-cancer therapies. My lab trying to answer three big questions. First is, why cancer cells are able to escape the anti-cancer therapy we designed for them, and how can we stop that? And second question is, most of anti-cancer therapy only work in a small proportion of patients. So we want to know, can we actually find a way to predict which patient responds to which therapy and match the perfect therapy for the perfect patient? And third is, we try and develop new therapies for some cancer do not respond to any therapy exists right now. So we are working very close to the physician colleagues at Yale and using all the cutting-edge technology in my lab, trying to solve these three big questions. This small rare clone has the ability to change it to some different cell it doesn't look like. But with spatial transcriptomics and single cell, first we can mapping them. We can know what you actually change into a new one. And with artificial intelligence, which AI do the best, is find a pattern. We do not what your identity is, but we can capture the pattern you change. And then design 3D-Cultured organoid. Organoid you can think about is like a mini pseudotumor. We can generate those pseudotumor from a patient tumor, which means we can test a specific drug. Basically, we predict your next move and give you the drug already waiting there. This platform works close together. Basically, is examining, prediction, and testing, and will help us to solve the three big questions. If we can find all those rare clones for not all of the tumor, but every different patient, each of the rare clone which cause their tumor may relapse in the future, and then we can design therapies to stop that before the tumor even relapse. And the second goal is use this precision medicine, which based on AI algorithm prediction and those little pseudotumor grow platform, we can give each patient a very different treatment design based on the AI prediction. And we'll have the most effective treatment before even give it to the patient to help our physician colleagues. Right now, our lab is working on prostate cancer and also bladder cancer, and especially because we're in the urology department. But you can say the platform we built, the AI system, the spatial transcriptomics, and the pseudotumor, we can use the same platform to any different cancers.